Kyle Mack here at MedPsych Health, sitting with Dr. Hanna, and we were just reviewing a patient, and we just had a pretty comical exchange. I was sharing a little bit about a recent presentation of a new behavior, or maybe it was a behavior that was getting a little bit worse, to be fair, and I couldn't figure it out. I was puzzled. And Dr. Hanna's like, "Oh, that was probably me." And I was like, "What? Probably you? That's such a strange thing to say. What do you mean?" So what did you mean?
So yeah, I'll tell you what I meant by that was that I prescribed a medication and made a medication adjustment that caused the problem. And this happens a lot more than people realize. As you've watched some of these videos, you probably know that medications have side effects. Well, you knew that probably before watching these videos, and a lot of times there's unintended consequences.
Right.
For example, sometimes you can increase the dose of something. Next thing you know, the person is really hyper and really impulsive and really aggressive, and that would be yours truly's fault, if you want to call it that.
And in Dr. Hanna's defense, I mean, this is, again, it's an unintended consequence.
That's correct.
It's not.
Yeah.
It's not something that we knew was going to happen, but it's
Right.
an onset of a behavior.
But we have to, right, and so a lot of times medications cause either new behaviors or a worsening of behaviors. And this is not uncommon. This is actually much more common than people realize, and it's always very important to always be able to connect the dots.
Right.
To say, hey, I made this change and this is what happened. Is this from medicine or is this despite of medicine? But it's not unusual, especially in younger kids, if you make a medication adjustment, to see something negative happen.
Mm-hmm. So right off the bat, I'm speaking as a therapist. Parents out there, of course, you're also going to be privy to this. You're going to see a change in behavior. I saw a change in behavior. We consulted about that. We tried to figure out what's going on here. But can you explain a little bit more about what are the types of behavior changes to look out for?
Yeah.
So I know what I'm looking for, but maybe some parents out there aren't quite sure what.
And I would say probably the most common one is an increase in anger.
Okay.
Is where I will find that and this is true probably for all the medications we prescribe, and that's a very non-specific symptoms, but you'll find that after a med change or an introduction of medicine, where parents will start noticing that their kids are more emotional, they're more sensitive, they're more irritable, they have a lower frustration tolerance, more angry, more acting out, more defiant. And a lot of times you'd say, wow, something's going on behaviorally.
Yes.
Well, I always go back and see what the last thing I did was. And it's not uncommon that the medication change was the cause for this.
Yeah.
And this happens across all medication categories.
Yeah. So that's just one example.
That's just one example
of an observed change. But
I'll give you another example. ADHD medications that are commonly prescribed, like Ritalin, Adderall, and Focalin, sometimes they can make a kid appear very anxious. Where all of a sudden someone who did not have anxiety appears very worried, very nervous, very obsessive, very compulsive, very clingy. It can be from medications. Or medications that are used for anxiety. Some of the common ones like Prozac, Zoloft, Lexapro, fluvoxamine, Paxil, all those, especially in younger children, they can go on a medication. All of a sudden, they're bouncing off the wall. They're hyper, they're impulsive, they're disruptive in school. Medications can do that.
Okay, so that is a whole, we just opened up a big can of worms here.
Yes, we did.
So it's easy to look at that and say, oh my goodness, psychiatry's the problem. If I only stuck to therapy or I didn't go there in the first place, we wouldn't have any of these issues. Well, I'm speaking as a therapist here. We can't look at it like that. There's a reason that we're trying to treat one thing,
right,
and we're seeing something else emerge. Right. So we can't ignore that. We still need to treat that original issue, and yet we have to be so sensitive and be looking for changes in behavior. And now I'm speaking to you as parents. You need to be sensitive to this. If you're a patient that is an adult patient and you're seeing a change in your own behavior, we need to look back and say, I wonder if this is because of a medication change.
Yeah.
And I will say the other thing that's so important, and we're stumbling upon this just casually in conversation, but it's so important because we are in communication. We can see what's going on with our patient
Yep.
and be able to discuss it. Now, if you're in a situation where you are seeing and working with a psychiatrist that's not in communication with a therapist, or just not in communication with you as a parent or with the family, man, there's a lot of stuff that
I
can be
think,
missed.
and also one of the challenges is that sometimes these side effects are subtle. They're not so obvious, and they take a while to be evident. That's why I always believe the very slow approach to medications, the low and slow and being very patient and deliberate, is so much safer. You know, the adage is for us as physicians always has been do no harm. And I think a lot of times medications can do harm. It does not mean they're going to do harm, but if we're deliberate and we're patient and we're cautious and we use an approach that is very systematic, we're less likely to do harm. And definitely communication with Kyle or a therapist guides me and helps me to get information, because this is not an uncommon scenario.
Yeah, so communication aside and kind of looking for those changes, what are a few recommendations that you would make for parents to be mindful of, to consider when they're starting to see something new?
Yeah, I always think that you always want to have a sense of, hey, what are we like before we made this change, right? And a lot of times I'll tell my patients, hey, here's what I want you to look for. I was saying this to someone yesterday. I said, I'm going to lower your medicine, and I want you to look at three things. I want you to know what happens with your fatigue. I want to know what happens with your insomnia, and I want you to know what happens with your restlessness. So we can say, hey, on this day, this is what it's like. I was concerned the medicine was causing all three of those things, by the way. And then I want you to track those. This is what I'm going to ask you at the next appointment. So I was very explicit. And a lot of times I try to tell my patients to be able to monitor for very, very specific things and then get back to me and let me know. So a lot of it is really knowing about, hey, before we make this change, what's going on? What are the different things we're looking for? And what am I going to look for positive, and what am I going to look for negative?
Yeah. So if I'm understanding Dr. Hanna correctly, we need to be looking at everything in the picture, the whole picture, but also it's important to ask what specifically to track. So as much as we want to look at everything, it's definitely a good idea to ask the prescriber, what should I be looking for? Especially after a medication change. So even when you're going in for a consultation, maybe looking to have a change in the medications or looking for a new avenue to go down, it's a good question to ask.
It is. It is a good question, and I think sometimes even myself as a prescriber, I'm remiss in actually being explicit about what I'm looking for, because I think sometimes as doctors, it's in our head, we know exactly what can go wrong, but we don't necessarily specify for patients, and I think sometimes I'm remiss in doing that, and it would be very helpful to always be explicit and tell our patients what to look for. I tend to tell them what to look for that would make them want to let me know right away there's a problem, right? Certain medications, especially medications for depression and anxiety, where we specify, hey, if you go on a medication or you increase your dose and you feel worse, you feel like you want to crawl out of your skin and you have this horrible physical anxiety and you feel like you're getting really bad thoughts or thoughts of self-harm, of harming yourself, you gotta let me know right away, because clearly this is not a medicine dose you should stay on.
Right. So that's where we're talking about the physical side effects, which are definitely, I would say, probably more obvious than some of those subtle behaviors that could.
I think it's the subtle stuff that's always the toughest. So I've had scenarios of situations where I'm treating somebody for anxiety, and they start getting in trouble in school. So you take somebody who's never gotten in trouble before, and all of a sudden now they're getting in trouble. They're disruptive. They're being sassy. They're being disrespectful. They're being rude. And we kind of have to start thinking through and going, okay, when did this start? Is this related to the medicine, or is this unrelated to the medication? Is it because they're having a negative side effect, or is it because they're not anxious anymore?
Yeah.
Right? Yeah. So it's my job to discern that and to help parents and schools to figure that out.
And that's an interesting point, because you're describing a behavior that's certainly problematic, right? Being all of those things in a school environment,
Yeah.
teachers are like, heck no, stop that, time
Yeah.
out. We don't want
Bad
that.
Dr. Hanna,
Bad
what's wrong
Dr.
with
Hanna.
you?
But at the same time, wow, we just solved, not solved, but alleviated a significant amount of anxiousness.
Yep.
That's a huge win. However, now we got to reflect
Right.
it back on the whole other part of the system, which is how do we rein in some of that behavior? How do we focus on, okay, so now you're feeling much more comfortable,
Mm-hmm.
but there's still a degree of what's appropriate and what's not appropriate,
Right.
what's too much, what needs to be parented differently, even as a teacher, what needs to be addressed in a classroom. So that's where it is such a it's not so cut and dry.
No, it is
it's
not.
a very different process.
It's not. And I think a lot of times there's a temptation when this happens to start wanting to treat something else without realizing that it's the medicine that's causing the problem. Because, and there's a whole nother video you guys can watch on polypharmacy. But I find that there are situations where I'll get kids who'll come in who are on 3 and 4 medications, and I'm going there literally almost scratching my head and going, what happened?
Yeah.
Why is 8-year-old on 4 medications? And what happens is somebody prescribed something to start, something wrong or bad happened, and they started adding, trying to address that, and next thing you know, you're causing another problem, and you start adding to address that, next thing you know, you're on 4 medications.
Yeah.
Versus saying, hey, is the first medicine the problem?
Yeah, so that's really what we wanted to share with you, that medications can cause problems.
Yes, they do.
And we want to put that out there, both as an acknowledgement that we want to be in this collaborative conversation with one another's professionals, with you as a parent or you as a patient, to make sure that we don't run into a mistake of missing a problem behavior because of a medication change, or missing the fact that we might be trying to medicate for something that's actually partially a success. That, wow, my child's less anxious, and they're coming out of their shell, and they're gaining confidence, and they're acting up in school. The acting up in school is a problem behavior, but it's not caused by the medication. It's actually caused by
A removal of anxiety.
a removal of anxiety from the situation, which is fantastic. So, so stay tuned, and we'll definitely cover some more topics like this, and just honestly share some of our reflections.
Yeah.
Yeah. Thanks. Stay tuned and subscribe below.